everyone, welcome to Enzyme MBBS. If you are an MBBS student and you are confused about what to study, what to revise, and what you can safely skip, then this video is exactly for you. In this video, I'm going to break down the topic into three very important categories that are must-read topics, may-read topics, and good-to-read topics, completely from an exam point of view. This classification will help you save time, reduce stress, and focus on high yield areas that are frequently asked in university exams. So make sure you watch this video till the end because this can actually change the way you study. Let's get started. So today our topic or the chapter is cellular adaptations and cell injury. So coming to the must read topics, before that I will just tell you about the color coding that I have written. Whatever that is written in red ink, they are basically the long essay question that comes for 10 marks, and the questions which are in black ink, they are basically the short essay questions which come for 5 marks, and the questions which are blue in color are basically short answer question which are 3 mark questions. So coming to the long essay, there is only one typical question they usually ask when they ask it is necrosis. So basically you have to write definition, types, examples, and its differences with apoptosis. That sums up the long essay. Sometimes they have also asked the apoptosis question, which is basically a 5 mark question, but what they do is instead of necrosis they give apoptosis and they ask you the definition, mechanism, and again you have to write the differences with necrosis, the difference between apoptosis and necrosis. So that sums up the long essay. Then coming to the short essay questions, the first question, it is pathology calcification. Now this can be under pathology calcification, basically you have two, right? Metastatic and dystrophic. They can ask separately each one of them, but the most probably they will, every time they have asked the whole, like you have to mention the both. And the next question is difference between reversible and irreversible cell injury. Now here you make a tabular column, and since it is for 5 marks, just don't keep it only for the tabular column. You just explain those points, then only you will get the marks there. And next, apoptosis. Third question is apoptosis. Basically you have to write the definition and mechanism, and then types of cellular adaptation with example. Now under cellular adaptation, as you know, there comes 4 things, that is hypertrophy, hyperplasia, metaplasia, and atrophy. Now if they ask types of cellular adaptation, you have to write all the 4 and you have to explain all the 4 a little. But they have some special affinity towards the metaplasia, and they usually sometimes they will ask directly metaplasia for 5 marks. So while learning the cellular adaptation, put more light on metaplasia, learn more about it, so that even if they ask metaplasia for 5 marks, you can write it. And the last short essay question that comes under must read topic is gangrene and its types. So that is also an important question. Now coming to the 3 marks, usually what they do is whatever the 6 short essay and 1 long essay we discussed, from there only they usually ask a gist of it as a 3 marker. Like for example, you have studied now cellular adaptation. Now they will ask you write about hyperplasia for 3 marks. Or they can ask metastatic calcification for 3 marks. Or they will ask dry gangrene for 3 marks. Like that they usually do. Apart from those questions, I have also mentioned 3 more questions which have some significance under 3 marks, that are list 3 endogenous pigments and label diagram of fatty liver. You have to do it in a H&E. And one more is autophagy with examples. So these are those questions. If you study this, you are good to go for exam. Most of the questions will come under this only. The next section, that is good to read. Now here, these are those questions which give you some extra edge in the exam, because if they want to go some out of the box, they will give these questions. So those are pigments and health disease. Now their endogenous pigments and exogenous pigments both comes. They can even ask individual pigments, but yeah, that is one whole topic. And one more is fatty liver. Again, you have to draw the diagram and you also explain about it. Then free radicals in cell injury and the differences between dry and wet gangrene. Again, if they ask the 5 mark question as differences along with tabular column, you have to explain, just like how you did in UMN and LMN lesion in the first year. And apart from that, one more 3 mark question that is I found interesting, only once they have asked, but yeah, you can learn it, that is causes and morphology of nutmeg liver. Then comes the may read section where these questions are basically very less likely to be asked. But yeah, for knowledge you can study, and to be on, like, if you want the full marks in this chapter, you can, if you want to complete this chapter as a whole, you can study these question answers. So they are hyaline cartilage degeneration, hemosiderosis, and brown atrophy of heart in short essays, and dysplasia, hyaline cartilage autolysis, and xanthoma in the short answers. So that sums up our today's chapter, that is cellular adaptations and cell injury. Now in the upcoming videos, I will also give you the complete answers, the exam ready answers, so that you can study from that only, and I will also explain those so that you can understand it easily and you can reproduce that in the exam. So that makes up the whole thing in our today's video. Follow more, subscribe it, so that you don't miss any of those questions and you ace in your exams. Thank you, keep studying, do well, all the best.